There are growing calls for the Liquor Amendment Bill to be reintroduced nationally. Some civil society organizations believe the move will help improve alcohol regulations at all levels of government. Joining us to tell us how strengthening the bill will help curb alcohol abuse is Maurice Smithers, Director of Southern African Alcohol Policy Alliance. Very good evening to you. Thank you so much for your time. How do you think this will assist in the big challenge of alcohol and its impact on society?
Thank you. Thanks very much. Well, the reality is that, we have a law in South Africa, the Liquor Act of 2003, and governments in 2016 or 2015 realized that the 2003 law wasn't adequate to address the challenges we have around alcohol. So they developed a new policy which was adopted by government in 2016. That policy was aligned with the World Health Organization global strategy to reduce alcohol-related harm. And then the Liquor Amendment Bill was introduced actually at the same cabinet meeting at which the new national policy was adopted. And that Liquor Amendment Bill would have given effect to the policy and would have introduced changes which would have assisted the country to address the challenges we have around alcohol more adequately. Unfortunately, in 2017, all work on the particular Liquor Amendment Bill stopped. And now, 5-6 years later, we're still waiting for something to happen. And we believe that if the bill had been passed, we would probably not have had the same challenges we had under COVID. And certainly we would not be facing the challenges as much as we are today. So we believe the bill, inadequate though it may be, really needs to go to Parliament. It needs to be discussed across the country, and it needs to be implemented as soon as possible.
Perhaps let's talk a little bit about the challenges that we're currently facing when it comes to alcohol. I mean, a lot of research has been done around the subject and its impact on society. Excess alcohol use brings societal harm, causing ripple effects in communities. And according to some policy documents from the DJ Murray Trust, it shows that 61% of homicides in the Western Cape are associated with alcohol, while 40% of men admitting to raping women mentioned that they were under the influence of alcohol. It speaks to a major, major problem.
It does. In fact, an interesting thing, a study was done in Britain in 2010, where they looked at 20 what you could call recreational drugs, of which alcohol and tobacco were two. So they, had the normal suspects like dagga and heroin and cocaine and ecstasy and various other drugs. Alcohol is the only drug that actually causes more harm to society than it does to the user. And that is not properly understood in our country, in the world actually, is that alcohol, it's damaging to the people who use it, especially people who drink too much. But it's the ripple effect, the consequences of the use of alcohol, the excessive use of alcohol, has dramatic consequences for society, in terms of road traffic incidents, in terms of gender-based violence, in terms of violence against children, in terms of the disruption of family life, in terms of loss of productivity in society, interpersonal violence, the burden on the public health system. There's a whole range of ways in which the excessive use of alcohol really does damage society. And that's why we need better legislation and a better understanding of, within society across the board, of why alcohol needs to be managed in a better way.
What will happen if there are no meaningful changes with this bill and really looking and reevaluating some of the clauses?
Well, if we don't come up with a way of addressing the challenges of alcohol, then we will simply carry on in the same way. And under COVID, for example, one of the things that happened was that in the beginning, government decided to ban alcohol, not something that we would necessarily have supported, but government decided to ban alcohol completely. And the main reason for doing that was they wanted to ensure that hospitals were not overburdened burdened by alcohol-related incidents. And they were correct in many respects, because what happened was there was an immediate drop in the level of people who were admitted to hospital with alcohol-related incidents, whether it was, like I said, traffic incidents or interpersonal violence and so on. If we don't introduce new legislation, what we are doing is condemning society to these problems happening indefinitely. And when I say to society, the reality is that we have communities across this country. Enyobeni, take Enyobeni as an example. Why did Enyobeni happen? Here we had a situation where 21 kids under the age of 18 died in a tavern. We don't know how they died and why they died, but the question is, why were they there in the first place? Why were these young kids in this tavern? Why did they believe that in order for them to celebrate the fact that it was holiday time, because that's what it was about a pens down celebration, why did they think that going to a tavern was the way to celebrate? But they did, and they went there and they died. And then a couple of weeks later, there were a number of shootings that took place at a number of taverns across the country. In Soweto, in Pietermaritzburg, in Katlehong, in Mamelodi. These things are happening all the time. In Enyobeni, we had a situation where the community said, we know that these problems exist. We have seen that these problems are happening in Enyobeni, but when we raise them, nobody listens.
So how do you think
and
this
just
will,
tonight, for
pardon
example,
me, interrupting you there really to steer this conversation, how do you think that these changes will then empower communities to indeed have a say in what happens around alcohol usage and distribution?
Look, the bill itself is not perfect. And the bill itself is not going to solve all the problems. But what it will do, it will begin the process. But what we believe is that government itself has to take responsibility for ensuring that people know what their rights are. And what we want to see ultimately is the same kind of shift in the balance of power, as it were, that we saw happening with the tobacco legislation. Because in 1999, the tobacco legislation that was introduced, which banned tobacco advertising but also banned smoking in public places, it shifted the balance of power between smokers and non-smokers. Because before that, if somebody was in a room with a smoker and wanted that smoker to stop smoking, it was quite hard for them to get the smoker to stop smoking. Now, today, smokers know that they have to respect the rights of other people. And essentially what we would like to see is a situation where people who sell alcohol and people who drink alcohol do so in a way that respects the rights of other people. So one of the things that we want to see, in addition to the Liquor Amendment Bill, is government taking responsibility for making sure that people know what their rights are and that they will respect people's rights. Because if I go back to Enyobeni, people in that Enyobeni community, they said that they had reported this particular venue many, many times, and government didn't listen to them. So what we need is a situation where people in communities have a say, a direct and meaningful say, over what is happening in their neighborhood, so that they don't feel held hostage or bullied. Actually, somebody used this term the other day to me, that people felt bullied by the liquor outlets in their area, because when they tried to raise concerns about noise, about violence, about various other consequences of the particular outlets they were in, they were not able to, they weren't being listened to. And this is not just in taverns, in townships. Just this evening, I had a conversation with someone who lives in Ilovo in Johannesburg, which is an upmarket area of Johannesburg, and they are suffering the same consequences. There's a liquor outlet that is run in the area which is causing havoc in the neighborhood. So we need not only this legislation to and the liquor authorities to make sure that people have a right and know how to exercise their right to a safe, secure, peaceful quality of life in the environment in which they live.
Absolutely. Thank you so much for your time. Let's leave it there for now. Maurice Smithers, Director at Southern African Alcohol Policy Alliance, speaking to some of the adjustments that can be made to the bill. Let's now remind